What if your doctor could prescribe a painting class, or attending a theater performance, or prescribe taking a walk in nature? Well, they can, and an emerging field called social prescribing is making its way to the US healthcare system. We have long known that many diseases, especially mental health disorders like anxiety and depression, are biopsychosocial diseases. Historically, within healthcare, we have treated the biological and psychological components of disease, but not the social leg of the stool. That's finally changing. Doctors and other healthcare providers from California to Massachusetts to Georgia are prescribing social care to their patients. Earlier this year, U.S. Surgeon General Dr. Vivek Murthy issued a notice about the growing social isolation and loneliness epidemic in the United States. Driven by the effect of the COVID-19 pandemic, social media, and fractures in our social fabric, social isolation and loneliness are an enormous cost to our health and healthcare system. In fact, being socially disconnected has a similar effect on mortality as smoking up to 15 cigarettes a day. But there is hope. Decades upon decades of research tells us that engaging with arts and culture can reduce social isolation, boost well-being, and improve health outcomes. That's where social prescribing comes in. This panel of national leaders in healthcare, well-being, and creativity will talk about the possibilities, the promise, and the challenges of social prescribing in the U.S. healthcare system. You will hear from a pediatrician on the role of arts and humanities in medicine, a psychologist on the need for community-based care, a researcher on the individual and community level impact, a healthcare payer on innovation in behavioral health coverage, and you'll hear from an entrepreneur on how it scales. We will talk about how arts-based social prescribing is improving outcomes for both individuals and the healthcare system at large.